Good afternoon, everyone. And today's class is on pediatric or orthopedic oncology, and it's a very interesting class, longish class, I would say. A lot of information. I have added a few videos to make things more interesting, and they are from all around the world. So I hope it helps. We'll be focusing on tumor biology, multidisciplinary management, reconstruction, very important, and survivorship, of course, since pediatric orthopedic tumors, so they happen in the early teenage period. So when they're cured, they have a long follow-up. So therefore, survivorship is very, very important because these cancers tend to come back. And whenever I take this class, I always give reference to if you've read the book or watched the movie The Fault in Our Stars. So the male protagonist, he has a bone tumor. I think it was osteosarcoma. But yes, please give it a go. And we'll start with today's class now. So we will be focusing on understanding the distinct biology of these tumors, the management strategies, reconstruction challenges, and the survivorship issues in the musculoskeletal tumors of the pediatric population. And by the end of this session, you should be able to recognize the key differences between pediatric and adult bone tumors, how to understand the managing the principles of osteosarcoma and Ewing's. So osteosarcoma and Ewing's are the most common malignant tumors of this age group. So I've mainly focused the class on these two tumors, but
Every
I've
year,
given a
thousands of children face bone tumors. But early diagnosis can save lives. Pediatric Orthopedic Oncology focuses on bone cancers in children. Common types include osteosarcoma and Ewing sarcoma. Advanced imaging helps detect tumors early. Accurate diagnosis is the first step toward treatment. Treatment for bone cancer may include chemotherapy. Surgical intervention is often required. Limb-saving surgeries are now possible. Professional rehabilitation ensures a better recovery. Targeted physiotherapy helps children regain mobility. With care, children can return to normal life. A multidisciplinary approach ensures the best outcomes. Hope and healing go hand in hand. Together, we can fight pediatric bone cancer.
to metastasize. They have the potential to metastasize early. And where do they go to first? To the lungs. And they often present with pain and swelling, like we saw in the video earlier. Now, about the growth plate, these tumors occur near the growth plate. As said before, surgery may damage the physis, and therefore there can be a limb length discrepancy. So we have to take care during surgery about that. And therefore, reconstruction should always consider the future growth potential, because on the table you might have done a marvelous reconstruction. You have both the bones equal, but the one that you're operating on, maybe you have damaged the physis, the contralateral side keeps on growing, and the patient will have disproportionate growth, which is not very good. So you have to take care of this growth plate while operating. We have a lot of myriad of reconstruction options now, and we'll talk about them in the later part of the class. Now, coming to osteosarcoma, this is the most common primary malignant bone tumor in children. Peaks during the adolescence when there is a growth spurt, and the second peak is during the 60s, late 60s. But it is curable when it occurs in adolescence. The common sites are
It
distal.
starts with a small pain, often ignored, but sometimes it's more than just a strain. Osteosarcoma is a type of bone cancer. It usually affects growing bones in children and teens. Common signs include pain, swelling, and limited movement. Early consultation can make a big difference. Imaging tests help detect the tumor. A biopsy is then performed to confirm the diagnosis. Treatment often begins with chemotherapy. Surgery removes the cancer safely. Today, limb-saving procedures are possible. Personalized rehabilitation then helps to regain full strength. Recovery is a journey of courage. With the right care, hope is real. Osteosarcoma can be treated if detected.